Recording. Okay. So tell me if you have any question, any of you. No? Okay. I think everybody else is following, rest of the girls are following the classes. I'm not sure about Akiko-san because her husband is in the still in the hospital. So I'm not sure about her. But rest of the everybody is following, right? And are you doing the homework assignments also? Please keep on doing and submit. Hard copy will be better, just a print out. Okay. So each section, you can take one topic or two topics in each section. Like first section was the basics of Ayurveda, right? Then it was the routines and the seasons and the yoga part. Then it was herbs, how to identify the herbs, right? About the herbs. Then medicine section was there. And now the last part is about the diseases. So in each section, you can select one or two topics and create a report about your understanding, about in your country, what is prevalent, what you use, and what you understood. You can do a case study. You can do some herbs of your interest or your local area. Okay. Or you can just take some topics from the book itself. Okay. And just elaborate it according to your understanding. Okay. Let's continue with the 19.8 method of diagnosis. Shindan, no? Shindan. Yeah? Diagnosis. Shindan. Okay. So once the disease is manifested, so doctor is supposed to make a diagnosis. So we can use various methods to make correct diagnosis. Here, as a health worker or as a family head, what you can do is till 4 points: accumulation, aggravation, spread, localization. You all can treat, right? Because here, what will be the lifestyle changes, your habit changes, your diet changes, right? And you can improve. Yes, of course, after manifestation and differentiation, that is the medicine part, and that involvement of the doctors would be there. But before that, you can still handle it. So once the diagnosis disease is manifested, doctor is supposed to make a diagnosis. So he can use various methods to make the correct diagnosis. In Ayurveda, it is called Nidana, means method of diagnosis. It is of 5 types to understand the disease. So it is called Panchanidana, 5 types of Nidana in Sanskrit. How we make the diagnosis. Okay. Because it is not enough to know the cause of the disease, but how it is affecting the body, which body tissues can be involved, and if the disease is curable or not. So it tells us more about that particular disease, right? That what can be the reason that it is you are getting it, what kind of tissues will be affected, what is the future of it, right? So everything about the disease uh, we can understand in Nidana section. Okay, so first is Nidana Parivarjana. Nidana itself means reason, Parivarjana is avoid. So it Nidana Parivarjana means avoid the reason. So it can be faulty diet, it can be bad lifestyle, it can be bad external environment, it can be because of job, because of weather, anything which is disturbing the dosha. So after understanding, we can avoid. Kathleen is there? Kathleen, are you there?
Yes.
Oh, I cannot see you. Okay, fine. So after understanding, we can avoid these reasons. In Sanskrit, it is called Nidana Parivarjana. Okay. So Nidana Parivarjana means uh, what is the reason? Avoid. So this is also a kind of diagnosis that I was suspecting that you have just I'm taking the example of hands only because hands we use too much. So that I have eczema just in my hands, and I thought that you are working with lots of chemicals. Okay. Um, Instead of going for lots of tests, lots of blood examination, and this and that, let me use my common sense. And I tell you, I think you use lots of chemicals. Okay. And I do not see it started from your hands. Can you do just avoid those chemicals for some time and let's see, right? And after some time, oh, my hands are fine. Okay. So that was the reason, right? So you made a diagnosis also and you avoided also. Okay. So that is also a way to make a diagnosis that I could clearly tell you that, you know, see, you remove this thing and you are better. You are eating this thing. Now I told you avoid and you are feeling better, right? So it was the cause. So that is the Nidana Parivarjana, that you removed few things and you can improve it. So you made a diagnosis that you have a problem with this thing. Or I just asked you to avoid kapha food. Okay, avoid kapha food and you are feeling better. Oh, I'm better. Okay, so this was kapha. Okay. So Purvrupa, next is Purvrupa means the earliest indication. This type of symptoms start showing much before the actual spread of the disease. We can take it as warning signs. Each disease is understood by its Purvrupas in modern medicine too. Like in epilepsy, Purvrupa will be poor vision, some smells, taste becoming strong, pain in the head. That is Thenkang. Thenkang. So we can immediately understand person is going to have an attack. In Purva means before the actual symptom. So some people like in a heart attack, what will happen? Purrupa, what will be the Purrupa? That for many days, people will. I'm just having like little stiffness or little bit sweaty, anxiety, but nothing wrong with the heart, right? So some people may start feeling these kind of symptoms 2, 3 days before. Some stiffness, and yeah, a little bit stiffness here or little pain here, but it's actually the start of the heart attack, right? My arm is little bit, I'm getting little angry or little sweaty or my blood pressure is little fluctuating. So these are the poor rupas that a person is going to have a heart attack. So same in Tenkang that before you actually fell down, you start having some, oh, I cannot smell, or the light is just, I cannot tolerate the light. So you start having symptoms first, right? When you start having symptoms, then you say, oh, I'm going to have attack. Let me just find some comfortable position and sit down before if I'm driving or if I'm on standing up, can fall down, you know. So by Purrupa, you can understand you are going to have problem. Okay, so that is also in the Nidana. Then is Rupa. That is the Rupa means how you look. Means in Sanskrit, Rupa means how you look. Okay, and here according to the disease's symptoms, how the disease look. So the symptoms of a disease. It means the actual start of the diseases with all the symptoms. So here, disease become more strong and defined, and we can think of actual course and how long it will take, or what will be the medicine, how much time to heal and all. So these are the symptoms that a disease is getting stronger and stronger and showing all its symptoms to you. And now you can decide how long it's going to cure. Okay, that it may be like a lifelong, like as I told you, like a high blood pressure. So if after certain stages it becomes like it cannot be changed. So you need to take care of your diet. You need to always take care of your blood pressure, that it should not go very high, herbal medicine, or lastly, chemical medicines, right? So that you can understand that this is now not curable, or how long it is going to be there, or maybe if I can decide that this is just a case of surgery, once you remove it completely and everything will be fine. Okay, right? So that is the symptoms that you can understand the actual disease life, how it will go. Next is upashya, exploring the treatment. In some problems, there can be same symptoms. So when engaged with more exploring tests or investigation, it is called upashya. It can involve the modern test or some procedures to identify the exact cause. Uh, upashya is exploring the treatment, right? That what kind of treatment will be good. Uh, sometimes, sometimes it is not very important to label the problem, but important is to find a cure, right? So many times we just cannot find. If if you have seen the infertility cases, it is a blind game, completely blind game. Mm, Man is healthy, woman is healthy. It's just they are just not getting pregnant, right? Everything is good. Almost 80% of the cases of infertility are like that. In some, yes, there is a problem. The sperms are not good quality. Motility is very less, and the quality of the sperm is also less. Dead cells are there, can be there, but in very less cases. In rest of the others, it's comparatively good, very good. Not very excellent, but good. And women also cannot find out any problem, right? So you will see that sometimes in gynecology, we just start anti-tubercular treatment, almost like a last, like, let me just see which one you will catch. You know? So last stages, I have seen thousands of my infertility cases where the gold test we do for the um, for the tuberculosis. So it's such a many diseases. We do just sometimes a blind game. Then let's take a chance. Let's give this also. Maybe it will help. We do not have any clue many times what to do next, right? In emergencies, it is 100% that you are just throwing everything. Something will hit, right? So in infertility, it is like mm, almost when everything fails, cannot find a reason. So I have seen they will do um, uh, gold test for tuberculosis, and gold test is a confirmatory test. Even if it is negative, they will still start anti-tubercular treatment, and many women will conceive. So means this is like a that you just start the treatment and see if it can give you results. Okay, so that is like exploring the treatment. That by treatment you start going towards the disease that you can find a diagnosis, right? Because you cannot find anything. Okay, so many times it happens. So next is samprapti, that is the development of the disease. It means to understand the root or course of the disease, how doshas will affect the tissues, After medicine, what results will be there, if it can be cured or not, like that. So when we study in detail about any disease, we check it with this list and understand the deep knowledge of each disease. So we could be able to find out the reason, symptoms, signs, and effect of medicine and future course of the problem. So with all these things, we can find out the life of the disease, the course of the disease, where we can treat, where we can make the lifestyle changes, where we can help, where we cannot help. So complete things we can get. After medicine, what results will be there, if we can cure it or not, right? So everything we will find out. Knowledge of Panchanidana by diagnostic methods is to understand the body and disease is very important. In older times, diagnostic aids were many and was followed by different gurus differently. So what are the diagnostic aids? Tests, tests. No? So what were the tests which were we doing before this modern system came? What type of tests we were doing? Now we will understand that also. So this is the five type of nidana. In Ayurveda, we said nidana. You can say diagnosis, not exactly diagnosis, but how to approach the disease. Okay, how to approach the cure. One is a person and another is a disease. So knowledge of both is important. Person important and the knowledge of the disease also important. That this kind of problem stay 5 years, this kind of problem stay lifelong, this kind of problem cure within 5 days by itself, you know. So both is important, right? Like viral diseases, after 5 7 days it will be cured by itself. You just have to keep your immunity and good food, good diet, and it will be fine by itself. You know, so these kind of the knowledge of the disease is also very important. Let's talk about now. Any question? You are understanding, right? Okay. So threefold of this may not be very useful for you because this is a more like a medicine part, but I just want to give you little awareness that how we approach the diseases. Of course, as I told you, in our medicines, when we study medicine, like Charak Samhita and all, so we have a complete chapters on one single disease. You take diabetes, so or you take a heart disease, so there will be a complete chapters, complete classification, and then their treatment. Okay, and treatment is also not one, maybe 30 type of herbal combinations they will provide, right? And different books will be providing different combinations. So a very huge knowledge and of the for the doctors. But this is just a common understanding that you can understand how we address to the problems. Okay. Let's talk about the diagnostic method. Like these days, we do pulse examination or eye examination. Then we check the blood. We do um, scanning, MRI or ultrasound or any kind of CT scanning, right? So earlier, what were the methods we were following? Number one way is three way of diagnosis. As I told you, in Ayurveda, there were three acharyas, the main, and then after that, these are the oldest ones, right? And there are not many mineral medicines mentioned in these three books because this is before Buddha time, right? So these three medicines, these three books, oldest found books, do not have much about minerals or metals, but more herbs. So later on, after Buddha period, so more minerals and metals started making medicine. So more strong medicines are there later on. So lots of different views, lots of different approaches are there. We will be talking about here in the diagnostic method. So according to one acharya, a greater view is three type of three type of diagnostic method that is very simple and easy to understand. Darshan means looking. Mitte, how you call in Japanese? Mitte. Huh? To look at
Mille.
meat. Mitte.
Mille.
Oh, okay. And okay, and the listening,
Kiku.
kiku,
Kiku.
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 Okay, kiku. Hmm. So darshana, look, person, touch, feel, right? And the last one is listening, prashna, asking, listening, questioning. So all will come here. So basically, they say three methods of finding the um, diagnosis. Either you will ask questions, how much is the pain, what you had, how was the fever, you know, right? Or you will be touching, uh, oh, let me see, oh, yes, there is a swelling here, right? Oh, it is warm, very warm. Oh, this is cold. This is very stiff, abdominal check. So by feeling, touch, and the first one is by looking. I look I look at you and I say, oh, you look sick. Are you okay? Not looking very fit, right? And doctor will see color of the skin, puffiness. So everything what we can have by our eyes, that is the questions. Okay. So this is the threefold method of diagnosis. Darshana means a look or by seeing or by observation. We make by looking at how one is talking, what is the swelling, if there is an oozing, right, or any blood or any kind of sign. Then is Sparsha. Sparsha is by touch, like temperature, surface. We can understand a few things by touching them. So, like pressing to see if pain is there and if there is any organ enlargement, it will come under Sparsha or touch. Okay. Then is Prashna. Prashna is by asking the question. So by asking or by questioning, like what happened, what did you eat, what you were doing, how it happened, do you had a fall or something hit you? So all these by when I ask the questions. So everything which comes by asking or telling comes under Prashna questions. So this is the threefold examination or the diagnostic tools, but uh, everything will come eventually here, right? Because okay, because as a person, I will be looking at the MRI, I will be looking at the reports, I will be looking at the person, or I will be asking the questions. So in nutshell, everything will come here in these three. Okay. So some acharyas say that these are the three things you have to be very careful. Next is, this is threefold, next is eightfold of diagnostic aids. So, and what are these? Number one is pulse, though it will come under feel, touch. But Acharya has said, let me make the points so that anybody can make the points and, check it. So he said that first is pulse, nadi, check the pulse. So by checking pulse, we can decide what type of doshas are prominent and the portion of the heart, condition of the heart. By practice, we can learn more accurate understanding by the pulse, and even we can tell about internal organs as clear as ultrasound. So earlier times, as I told you, because of some problems also that some people will not allow you to touch, or like a woman, so many religions do not allow women to touch or to see, so they will be just giving you your hand. So those were the times that the woman will not be out, so you have to diagnose by just a pulse. So by pulse, these people become um, so much strong that they could tell all your organs by pulse only. It is a bit difficult these days because many people claim, but it's not that easy. It's just like just the claims only. But yes, we can see the situation of the doshas very easily by the pulse. Okay. So first was the nadi, and then was the mutra and urine. By your urine, uh, you can you can understand lots of problems, including your kidney. Examination of urine is called mutra pariksha. Like these days too, it is important to do the urine examination. In ancient time also, we were doing like quantity, color, consistency, pus is there, sugar is there. So we will be doing that in the urine. These people were so clever, and the way of understanding were so different. I will tell you that they will, for urine examination, um, they will collect the urine in a pan and will put oil on it, a drop of oil. And there were some diagnosis they will make according to the how the oil is spreading. Sometimes you just put the oil drop and uh, it will splatter, and sometimes it will just go and sink, or sometimes it will be just suspending. So they will make diagnosis according to that. I mean to say their ways were very different, not like crude that of like these days. It's very crude that you want to find out which chemical is this, which can be millions of chemicals in the urine. You cannot find out everything. Another example I can tell you about urine is that they will check the sex of the baby, or hormones by urine. So I heard in some books it is mentioned that they will give you some kind of grains. I was reading in one of the books that um, the wheat, oats, right, and some kind of grains have different kind of hormones to promote the growth. So they will give you in a bolus of cotton some grains, and will ask that when you get up early in the morning, first urine, do on these. So every day you will put your urine first urine on these small bags, which will germinate first, and they will say, oh, this hormone is so strong in your body. So, what can be the problem? Is it a male child or a female baby or some other issue that you are secreting this hormone so much from the body? We do not have the complete things now with us as we were discussing, but their way of approach was so different, so different that we still scientists have not gone to that stage that you are doing so many of chemical analysis. Why we cannot use some common sense that some kind of hormones are very reactive to certain kind of germination. So we so this is just little examples somewhere in the book which are not very clear, but we can understand with the see with the oil also. It's such a simple and beautiful test. Probably they might be checking the specific gravity. They might be checking the the thickness or suspension. So they had their own criteria to understand the because they were thinking about the doshas more, right? So probably they could diagnose with these things very clearly. In fact, the future problem also, right? So these are some of the examples we can find out in the book somewhere, but because we lost many books, so we have not the clear books about the diagnostic methods. For medicine manufacturing, later on books we have lots of, and they are untouched. They are complete books, but rest are not there. Even on the pulse examination, there is a mention of a complete book, but we do not know if it is available or not. Right. So then is the Mala Pariksha, number 3, examination of the stool, color, consistency, blood, or any type of infections will be checked through stool examination. Then is tongue, jiva. If tongue is coated, ulceration is there, if the color is normal. So Agni can be checked also at looking at the tongue. If your tongue is coated, white in between or red here or there or some blue marks, some teeth marks. So all show the condition of the digestive tract also. All right. Motoko-san, in Chinese medicine, I think they have a good part on tongue examination.
Yes, the must pulse on the tongue is a must.
Yes. So please make a note on that. Let's see
Okay.
what you can find out. Right? Okay. So Shabad Pariksha, how is the sound? So by listening to the sound of the person, by listening how he is speaking or he is unable to speak, yeah. So if a person can speak to us, we can find out lots of problems, right? How they are speaking, how nervous talk, anxiety, palpitations, state of mind, no? These are the problems of the mind. But otherwise also how is your, your throat, you can understand by the voice, you can understand the pain also, how they are speaking. Is it very painful, less painful? So by the way they are speaking, you can find out. So Shabad Pariksha, examination of the sound is very important. And in the Shabad Pariksha comes sound of the heart, sound of the lungs, sound of the stomach, sound of the joints. So every sound will come here, which you can check. Then is the appearance or the look. How a person is looking is also very important method to understand the problems. When you are in the hospital, you can so a group of people is coming, and you can easily understand who is the sick. Yeah. and rest are the relatives or the family members, and you can make out, oh, he's the sick person, right? So by look, very, very important, and you can check uh, by look, disfigurement, or blood is coming, or um, limb is broken, or yeah, by having a look, you can understand all those things. Then is teeth. Oh, so 2 minutes are left. Okay. So teeth, how is the health of the teeth? They look healthy. So teeth is also very important with smelling or something. So all these things show the internal health also. Teeth also tell you about your bones. Healthy teeth are an example of healthy bones in the body. Then is nail, the you know the Naka. So also check nails. Healthy nails means good health. Likewise, we can check many other conditions through nails too. Many people check the nails, right? So nails are also a very healthy, very good indicator for your health. Even the modern medicine also say that. In many cardiovascular problem or lung problems, your nails change the shape. This is not only mentioned in the traditional medicine, but in modern medicine also. They know that in many, but they know it in the later stages when the disease is fully developed. So your nails change completely, right? Just have a study on this also. Catalin, maybe you can study on the nails. Just make a note on the nails with the pictures. You will understand that. So we can share with each other. Okay. So nails, you will see that nails will show you all the problems. Okay. And the rest of the examinations, Kazumi-san, you can do that if you can find out some other examination. Okay, then next is Dashavid Pariksha. Shall we continue or you want to stop?
You can
Continue.